say, with my another very close colleague, friend, Dr. Amitabh Banerjee, who is Professor Emeritus from T.Y. Patil, Pune, and he is the public health expert. And you will hear from him, you will read him many times at different platforms. Dr. Amitabh, what do you think that since we have started talking about patient safety, so in what way we can create an impact in the youngest possible age of a student, right from undergraduate and postgraduate, if they are aware of all these steps, perhaps they will become a safest clinician. What is your opinion about it?
Thank you, sir. I would try to talk something about some system failures. I mean, the young generation should know, like, medicine was an art to start with, and the greatest practitioner of the art was the general practitioner. A family physician, one doctor used to see many patients, and today it is just the opposite, specialization and super specialization. Of course, it is very essential because of the complexity and technological advances. Medicine is becoming very complex. So, from the art of medicine, the present day is the art of managing complexity. The art of managing complexity is perhaps getting humanly impossible because of the super specialization and hyper super, and many interfaces have come, like medical equipments, bioengineering, and rightly now we have got clinical bioengineers. As Dr. Gyani said, then, as Dr. Agarwal said, that the treating team is the captain, is the doctor. Here, one thing is, it is almost becoming like managing a large airport. There are many captains, many aeroplanes, many flights. And here, similarly, now we have got many treating teams. Now, elderly population have got multiple comorbidities, and one patient is managed by many teams. And as rightly brought out, most of them are working in silos. So, in their own domain, they may be trying to see that there are no errors, they may be checklist. But what one thing is missing, if we take another analogy from the aeronautical engineering or flights, there some ATC is missing. Like, we have got air traffic controller. So there is no one general practitioner, like the system in the UK. They have got an NHS. All the patients are routed through the general practitioners to the specialist and super specialist, and they come back to the general practitioners. Because I have seen personally, the one patient has been getting prescriptions from number of 3 4 super specialists, and there is maybe some drug interaction which is overlooked because one specialist doesn't know what the other specialist has prescribed because there is no time. So if there is a general practitioner, the status of the general practitioners has gone down very much, and no young graduate or undergraduate, nobody wants to become a general practitioner because there is no status. So it is looked down. Everybody wants to become a specialist. They want to become pilots. So we require some ground staff also who is a general practitioner. And if we have good general practitioners, that can come up as a specialty. That's something jack of all trades. So they can coordinate the treatment across various specialties, and they can add something akin to air traffic controllers. Actually, this is just loud thinking. I am just not crystallized my ideas. This is just loud thinking when I see the complexity which is increasing due to technological advances, just like flight control. But we should have a good air traffic controllers at the ground level who can work, who can be a communicator to the patient and to the specialist, some sort of an intermediary, because specialists do not have time and they do not have time to interact with the other colleagues who are treating the same patient. So if there is a common denominator in the form of a general practitioner whose status should be as high as that of a specialist or super specialist, because he or she is managing across disciplines. So if something can come up on those lines, that who are good communicators, may not be exactly maybe a counselor, maybe a doctor, who can work across specialties and communicate to the patient I think that is something, I mean, which came to my mind.
Thank you. Thank you, Dr. Amita. It's a very important aspect, that is the entire channel of looking into the patient. A referral system, who will see first, who will see second, and when should they be referred to the super specialized persons. Yes, I know that is a system failure in our country. And I'm sure organizations like CAHO or ASPI and NABH, and perhaps with their efforts, some sort of step will be taken so that I agree with you, Dr. Amitabh, that patient is loaded with the prescription from different ABC super specialized doctors without knowing the fact that which are the drugs which are interacting and perhaps bringing the side effect. This is a very important aspect which I feel Dr. Gyani and Dr. Vijay and Dr. Joseph and my other colleagues should keep in mind how to perhaps overcome it.